Hi guys, Dr. Dan Nightingale here, your clinical dementia specialist. Wherever you are in the world, I hope you're having a great day or a great evening. If you're in Australia, it's probably tomorrow already, so I hope you're having a good tomorrow. I wanted to talk in this video about emotions and how we can express them. Sometimes the journey of dementia can be very, very challenging for the person who is living with dementia, challenging for the people who are supporting that journey, be it informal caregivers such as family members or friends, or formal caregivers such as support workers, doctors, nurses, and other professionals and other people's support systems. So we've got to express emotions, and one of the emotions when we're very stressed is agitation, frustration that turns into aggression, anxiety and fear. Anxiety and fear, they are two things that fuel the symptoms of what we call the BPSD, the behavioural and psychological symptoms of dementia. Anxiety and fear. Imagine waking up every day and not recognising your environment. Imagine waking up next to somebody you've been married to for 30 or 40 years and not recognising them. Imagine how frightened and how anxious you become. So I think it's really important that those emotions are addressed. We have to express our emotions, whether they are positive ones, such as love, or whether they are negative ones, such as anxiety, fear, or anger. We have to express them. It's how we express them that makes the difference between being carted off to a behavioural health service or a place of safety, or being able to express that emotion in a proactive way, in a constructive way rather than destructive way. And of course, if it's done in a constructive way, we're not going to be carted off to a behavioural health or a place of safety. We're going to be able to express it safely, just like we should be allowed to. There's a number of ways that we do this. Conversation, being able to talk about it. Some people with dementia are not able to express how they feel because they're not really sure, or they may not always be sure. So let me change that language. Sometimes people are not sure what it is. And if you think about yourself, whether you have dementia or not, it's the same thing. Sometimes we don't know what's wrong. Sometimes we feel blur, but we're not sure how or why we feel blur, and we're not able to express it, because it's usually something at a subconscious level rather than the conscious awareness. So think about, if we can't have a conversation about it, we're not able to identify it, think about expressing it through art, drawing, sketching, colouring, things like that. If you ask somebody to draw a picture, if they're experiencing a negative feeling, a negative emotion right now, whether that be sadness, whether it be anger, frustration, agitation, fear or anxiety, when they draw something, it will be expressive of that emotion. It will be expressive of that mood, of that time. So that will give you an indication of what the person is really experiencing, and it'll give you an opportunity to engage and to bring that from the subconscious mind to conscious awareness so that it can be addressed. Because addressing things is so important. The easiest way is to distract somebody. The easiest way is to say, oh, everything will be all right, let's go and have a cup of tea. Everything will be all right, let's go for a walk. Well, everything won't be all right unless the emotion is addressed. Then it'll be all right. And it's the most difficult part, is addressing it. It's not as easy as distracting someone and saying, let's go for a walk. Talking about a deep-seated emotion that is affecting the person is difficult. It's not easy to do. But we have to learn it, we have to practice it, we have to feel comfortable around that person and allow them to express themselves in a constructive way. So that's one way of being able to do it. Two ways, sorry, if the person can express themselves. The other one is through exercise, physical exercise. Express it, get rid of it. Even if we don't know what it is, get in the gym or go for a walk or do some exercise to get rid of that energy. Because at the end of the day, everything is energy. Sometimes it's positive energy, sometimes it's negative energy. Just get rid of the energy if it's negative. So yes, go for a walk. Different than being distracted. It's different than a distraction technique. It's you managing it. It's dealing with it yourself. Go for a walk. Get in the gym. Work it out. Primal screaming. Some people may have heard of primal screaming. That is very cathartic. It's very therapeutic. Go outside. Scream at the top of your lungs. Bury your face in a pillow and scream if that is more practical, if you don't want to frighten the neighbours or the dogs or the neighbourhood cats or whatever. So just express it, get it out, let it go. One of the worst things we can do is bottle up our emotions. And if we are living with Alzheimer's disease or other cognitive challenge, then it can be difficult. Because if we start expressing those emotions, people think, oh my goodness, the dementia's getting worse, this is happening. But it's not always a crisis. It's something to enable, it's something to support, and it's something to encourage. Just express yourself, get it out. So our emotions are very, very important. And if you think about anxiety and fear being the two most common fuels of the behavioural and psychological symptoms of dementia, then it's those two things we need to think about, we need to focus on. How do we cope with, how do we support, how do we enable somebody to work through the journey of fear and anxiety? Cognitive behaviour therapy is one approach. This is my triadic approach again. Cognitive behaviour therapy is one of them. Engaging in positive activity is another one. And then thirdly is hypnotherapy and hypnopsychotherapy. They are fantastic tools to use. Obviously, one needs to be trained in hypnotherapy specifically for people with dementia, and hypnopsychotherapy specifically for people living with dementia. But the other two things are pretty straightforward, and you can learn to do them yourself. And then you can tap into a professional, one of my Nightingale dementia consultants, for example, to help you with the fear and anxiety in reduction through hypnosis and through hypnopsychotherapy. So that's what I wanted to talk about on this video. Thank you for listening. If you have any questions, any comments, anything that you think I can share with my followers, my listeners, and there are over 2,200 of them. There's a lot of people following this channel now and following my Facebook page and Instagram. If there's anything that you think would be beneficial for me to share with them, please let me know. Comment on this YouTube channel, send me a message through Facebook or Instagram, or send me an email, drdan@drdanielnightingale.com. If you need help, if you need support, if you need a consultation, let me know. drdan@drdanielnightingale.com. Have a fantastic rest of the week, and during the day, every day I'm popping little short videos on Facebook. I'm doing live videos on Facebook just as incidents happen, and as I work with my patients. If there are things that I think this would be useful to share with my followers and my listeners, I put it on there. I do a quick Facebook live video. Okay, so that's me. Have a fantastic week. If you need me, I've told you where I am. Visit my website, drdanielnightingale.com, and you can find me on Psychology Today as well. And you can Google me. All right, take care, and I will see you very, very soon.